Thanks for coming back and joining us to BRMC's Healthy Connection. Our special guest today, Dr. Cliff Croom. Dr. Croom, we were talking during the break about prostate-specific antigen, or the PSA test. Could you tell our viewers a little bit more about what that specific, I can't even get the word out today, specific test is and what it does?
Well, it's a blood test.
Okay.
And the prostate-specific antigen is actually a protein that's made by the prostate gland. And you have normal small amounts of this in the blood all the time. And we can do a blood test. We can check the level of that and see if it is elevated, which would suggest a problem. Okay. You develop the prostate-specific antigen as you get older. Smaller prostates and younger folks will have smaller levels. Normal's up to about 4. You might expect in the 20s it to be less than 2. But as you get older and up into the 70s, it may be up as closer to 4. If it gets above 4, then it can represent prostate cancer. But there are other things that can cause it to be elevated, such as infections like prostatitis, and also just enlargement of the prostate, which is a condition called benign prostatic hyperplasia.
And what causes that? What would cause the prostate to enlarge?
Actually, it's common in men in general. Okay. As they age, for the prostate to become a little bit larger. Sometimes that causes symptoms as it closes off the urethra. They have difficulty urinating. Sometimes they have problem with hesitancy with urination or frequent urination. Sometimes you get up at night several times to urinate, and this can be a prostate enlargement problem.
Okay, so if the markers came in, then, well, let's go back to, and I'll ask the question, when should someone be screened for a PSA test? I mean, is this something annually that...
There's some controversy on it. Not all doctors screen for PSA. There's debate over whether or not actually finding prostate cancer early actually saves lives, or whether it subjects men to procedures that, of course, cause anxiety and stress and potentially complications. So not all doctors screen for it. I think probably most do, and I'm of the opinion I'd rather know than not.
Sure.
So I generally do recommend prostate-specific antigen testing as a screening test after the age of 50.
After 50. Okay. Now, boy, that 50 is quite the age marker for men, women, for all sorts of things, isn't it?
Lots of things actually occur at age 50. Sometimes we do recommend they get it screened before 50, somewhere between 45 or 40, if they have high risk factors. Risk factors can be a family history. Also, African American men tend to have the highest risk of prostate cancer, so they may need to be screened earlier. The American Indian and Asian men tend to have the least risk, so they would be screened not until at least 50.
Genetic, maybe a genetic factor or a dietary factor, a little bit of both?
Actually, there is a potential dietary factor. They feel like that men that eat higher amounts of animal fat may be more prone to developing prostate cancer.
Right. That would fit in then with Asian gentlemen eating fish as a staple, probably.
Well, of course, fish aren't very fatty, so I don't think that's as big of a problem for them. Yes.
Yeah. Yeah. So they may.
But for those of us like that, hamburgers and steaks, that's the problem.
Yeah. Eating that meat that's so good is just not necessarily real good for us, is it?
Sometimes not. That's
sometimes not. What else can you tell us about the PSA test, or about PSA once the test results come back? What's the next step for someone to go through?
Well, of course, if your PSA is normal, and or normal for your age, that is, like I said, if we had a 20-year-old that we checked it for some reason and got a 4, then that would be a problem. If we have a 70-year-old that has a 4, that may not be as much of a problem. But if the PSA is elevated, then we have to go through the steps of trying to figure out why that PSA is elevated. Is it because of infection problems such as the prostatitis, or is it related to enlargement of the prostate for benign causes, or could it be a prostate cancer? We do the digital rectal examination as part of that evaluation. that procedure is just as simple as putting a gloved finger in the rectum and checking the prostate through the back of the posterior wall of the rectum, looking for really enlargement. We're also looking for nodules on the prostate that could represent a cancerous nodule or other abnormalities in that way. If we do feel like that there is significant concern for prostate cancer, then other tests may be necessary, such as a referral to a urologist for a cystoscopy, which is a test where they actually look up into the bladder with a scope, again looking for enlargement of the prostate. Sometimes they do transrectal ultrasounds, which is an ultrasound kind of like the ultrasound of a baby, but they use a sound wave so it doesn't hurt, but they do that through the rectum and into the prostate. If they see abnormal areas, they can actually do biopsies through that same rectal probe. Biopsies, of course, can tell for sure whether you have prostate cancer.
How effective, how reliable, I guess I would say, would the ultrasound be? Which of the two tests might be through the urologist doing a procedure or through the ultrasound?
Well, the urologist will probably do both of these tests. But certainly I think the ultrasound is going to be, and the biopsy is going to be the most accurate in diagnosing prostate cancer, but of course the most invasive. Since we're doing a biopsy, they're actually putting a cutting needle into the prostate, removing some tissue, and so the most invasive. And it has risk of infection and bleeding, so we don't want to do that unless we just absolutely have to.
All right. So there'd be all of these steps that would be taken, in other words, as non-invasive as you possibly can be, and still get to the core, what's really going on here.
Correct.
Yeah.
And in some cases, we won't even take that next step. We'll just continue to watch the prostate blood test and see how rapidly it rises. As long as it's not rising more than about 3/4 of a point on a yearly basis, so that's called the PSA velocity, it's probably okay. Or if it's doubling very quickly over a few years, then that may be more ominous. So it's really a complex situation where you have to put everything together clinically and make the decisions about how to proceed.
Right, what should be done. But, how are the PSA tests reported? You said it was detected in the blood, and we've talked about the various levels on here. So I guess that's just the blood test is the first thing that would be done.
Right.
And you're going to take a look at that. That would be step one. Based on that, if it was gentlemen, let's say in their 70s, and it's a 4, then you're going to go to step number 2. And what would that step be again? So that our
probably
listeners...
the digital rectal exam would be the second test to do.
Okay.
And usually done in conjunction. So we do the digital rectal examination and a prostate blood test fairly simultaneously.
Okay. I know that you're doing some PSA free testing down at the Freeman Medical Center. And,
we are. We just recently had an event where we had men come in for free PSAs and rectal examinations.
That's wonderful. That's something that I know our community certainly will benefit from.
We're glad to do that.
Yeah. And you're located again, I know you're at 17... Medical Plaza. All right.
That's right next to the hospital.
Right next to the hospital. Right. I know I go by there. Let me see what else I've got here. I've got some notes I took that I wanted to be sure and go over with you. Being a layman, I'm always trying to make sure that any of our viewing audience that we get that information out to them at a level that they can absolutely understand. This is something you deal with day in, day out, and
sure.
the event that you just had recently for people from the community coming in. So I'm going to go ahead and just take a look. What are some of the limitations? This was something that came out of the research that I'd done. What are some of the limitations of the PSA test?
Well, it doesn't always mean you have prostate cancer. So an elevated PSA doesn't always mean prostate cancer. There are other things, as we mentioned, that can cause elevation of the PSA. And unfortunately, a low PSA doesn't always mean you don't have prostate cancer. So it's still possible to have prostate cancer with a low PSA. So it's just part of an overall evaluation.
It sounds as though it's a very slow progressing type of cancer.
It is, and many men can, well, actually almost all men will have some degree of prostate cancer if they live long enough. But it is a very slow-growing type of cancer, and in many cases, a prostate cancer is going to be so slow-growing that it's really not going to affect the overall health of the individual throughout their lifetime. And there's part of the controversy as far as, do we actually need to find this prostate cancer and treat this prostate cancer on someone where it may not be clinically significant for them throughout their lifetime? Of course, there's the rub. How do you know if it's going to be clinically significant for them or not?
Sure.
There's just a lot of research going on to try to make those determinations.
Is this something you sit down with your patients and discuss with them to give them the options? As far as, if I were I'm going to jump it up. If I were about 80, 85 years old, I think I would, and a gentleman, and the PSA test came back, it looked as though, in all probability, that I might have prostate cancer. I think I would like to know that to make the decision on whether or not to progress, to put myself through maybe some type of testing that would be detrimental to my quality of life, I guess is what I'm trying to spit out here. I think I'd be looking at it from a real quality of life issue. Do I just kind of, at this point in time go on just the way I've always been, or is this something medically that I want to put myself through, put my body through?
Sure, that makes sense. Yeah. And I am also the opinion that more information is better than less information.
Sure.
So I'd like to know and be able to make a decision about it rather than just not knowing.
Not know about it, sure.
Now, at age 80, after the age of 80, I really don't do PSAs on a regular basis.
Oh, okay. So you've got that window from 50 to about mid-70s?
No, really about 80.
About 80, 50 to 80.
But if they're over 80, and I haven't found it by that time, the chances that they're going to develop a clinically significant prostate cancer that's going to affect them during their lifetime is fairly low. So actually doing screening after age of 80 is probably not as beneficial.
Do you feel like at times, I've talked with other physicians and doctors about a variety of issues, one of which is because we're all living so much longer, it's like we're all tracking new snow here in so many areas and realms that we just have never, we have no basis to decide what to do because none of us have ever lived that long. So it's kind of interesting. It
is, and you have to look at it not only from chronological age, but also physiologic age. That is, you have some 80-year-olds that are really 80 years old and not doing very well health-wise and so forth. Other 80-year-olds are extremely active and have very few medical problems and can be expected to live another 10 to 15 years.
Right.
So if we see a patient that is actually doing real well and wants to know more about what's going on, then we can certainly consider that.
Sure. Sure. Dr. Croom, we need to take a break right now, but we'll be back. Don't go away. We're going to share some more information with you. I'll see if I can find my tongue and untie it by the time we come back from our break. We'll be right back. Thank you.